I wrote to him and I said that just because my name is Khan Khan, you feel that my data is not reliable. And if my name was Kahn Khan, because that's a German Khan, so there is a German Khan as well, which is Kahn, my data would have been reliable.
Assalamu alaikum and welcome to the Health Talk powered by Dental News. I am Dr. Maliha Malik and today we shall be talking about clinical research and the scope of clinical research in Pakistan. We have with us a very renowned individual in this industry. He has done his BDS from D. Montmorency College of Dentistry and MSc in Epidemiology and Health Planning from the University of Wales and has a PhD from the National University of Ireland. Assalamu alaikum, Dr. Ayyaz Khan, how are you?
I'm good.
Dr. Ayyaz, please tell us a little bit about yourself.
Long story, but just a short of it, I graduated in 1980, went to Zimbabwe in 82. From there, I went to Saudi Arabia for a very short stint of about 10 months. Then I went to there in Saudi Arabia. I won the Charles Wallens Trust Award, on which I did my masters in epidemiology and healthcare planning. Came back to Pakistan. Was stationed at Sheikh Zayed Postgraduate Medical Institute for 26 years, and during that time, I did my PhD as well.
Right.
So that's what.
So, Dr. Ayyaz, what is the training required to write a clinical article?
You need to be trained for anything. If you go for driving, you need to have a training in driving. You need to know the rules. You need to know the signs, and you need to know what speed you go in. So I agree to the fact that everything requires training, and clinical research requires a fair amount of training.
Right.
There are opportunities available. In Pakistan, at least, there are 4 or 5 institutions that are offering diplomas in clinical research.
Yes.
So that's one way of doing it. Or do it like I did, hit and trial, get embarrassed, because I've been embarrassed so many times trying to write an article and trying to do a study, because at that stage I was not very fully trained for that.
Right.
It was after my training in epidemiology that I started, finding out where I went wrong. So
and doing a diploma is
gives you a start.
Right. So do you believe that there is a scope of research in dentistry or medicine?
Oh yes. Dentistry and medicine thrives on research.
Right.
But the issue, I've interacted with a lot of people who want to go into research. For example, if you ask me what I have done in my life,
Right.
so I would always say that I have produced 29 MPhils and 7 PhDs. So that is what my thing is. So the scope of research is there.
Right.
The issue is that I get a lot of kids coming to me and trying to go into research and trying to do some research projects. And they always tend to do what they want to do.
Right.
And that is not how research works.
Okay.
In research, you need to see what is the need of the time. For example, we started doing research in oral systemic conditions. And we did it for 10 long years. And we started it when the West had just started it as well. And we did fairly well because there is a lot of interest in that.
Right.
You are able to get research grants on it. Now, if you want to, research is unlike poetry. Research does not improve with repetition.
Right.
So what we tend to do is that I see an article, I see a paper, I say, God, this is good. Let me do it at my hospital.
Right.
How would it be different? And that is not clinical research.
Right.
Clinical research is trying out new things and trying out things that have
not been done before.
That have not been done before, or that are more viable in your surroundings. So if I have to do a research on dental materials, I would probably not go for a high-end composite. I would probably go for a filling material which will be very stable on a baseline level, where I don't need to control the moisture for a long time, or I don't need the sophisticated equipment. Something like ART, an advancement on the GIC that we've been doing. So that is something, because that is the requirement of this place. So what we need to do is basically to look at what the global trends are,
Okay.
what has not been done. And I tell you, it doesn't mean that you need to reinvent the wheel.
Okay.
The wheel is already there. You need to see the spokes, the wires that run in the wheel.
Yeah.
Which of the wires are missing? So if you go through a study, you will always find an issue that has not been addressed.
Okay.
Something that comes into your mind. And then life has become very easy now, unlike what we used to do. I remember when I was doing my PhD, we used to have these CDs in which we would get the PubMed articles printed out, no abstracts, nothing doing, just the topics. And then you would get those topics, we see which one matches you, and then we write to the library, and the library would then send you the articles, and then half of them were not what you needed. No, all you have to do is go online and check out what has been done.
Yeah.
So life is information, there's an information flood that is uncontrollable. I was told the other day that the information package actually doubles every 6 months. So a hell of a lot of information there.
Yeah.
So what you need to see is, okay, fine, I see this scope. Let me find out if somebody has worked on this. And if somebody has, you can add evidence to that.
Okay.
Or but you should not repeat what somebody else has already done.
Right.
And that is what the trend is. I'm sorry to say, but majority of the people that come in do that.
So, Dr. Ayyaz, why look at global trends? Why not do something domestically that has not even been done domestically?
Brilliant. Why not?
Because I mean, in our society, it's slightly different from the West, and the issues, oral or otherwise, are very different from the West.
Otherwise as well, my child, things are the same. The oral health, the oral structures,
right,
they are the same.
Yeah,
I'll give you a small example. When we started our work, we did a bit of work on the cardiovascular diseases and periodontal disease.
Right.
So we wanted to establish a link in that. We got a PhD out of it. But the prime thing that we did was that 2 years ago, Dental Research, which is the premier journal of dental research, it published an article on the history of evolution of periodontal medicine.
Right.
And it referred to 12 articles. And Alhamdulillah, ours was one of them.
Mashallah.
So what we did in that study was that we did simple scalings, and we found out that based on the inflammatory markers, that we actually reduce the risk of a cardiac episode by 18% if you do simple scaling.
Right.
Now this was huge,
Yeah.
And it was not done before. The reason was that the largest study that was done previous to our study was 67 patients. 67 patients, because you can't find those patients which have no other inflammatory condition. We went through 5,000 because we have a hell of a lot of patients. So it's a
Yes, definitely.
research playground, honestly telling you. So we had about 5,000 odd patients at the Punjab Institute of Cardiology. We went through them and we selected 272 out of them.
Okay.
And that by default, well, we didn't do anything special, but by default that became the largest ever randomized control trial done in the world to date. So so people will replicate you if you actually take the initiative here.
Right. So, Dr. Ayyaz, are there any submission guidelines for a successful manuscript in research?
Every journal has their own.
Okay.
And they're right there in black and white. Any website you visit, they would be there. They would be there.
And you're the editor-in-chief of Journal of Pakistan's Dental Association. Please do tell us what are the challenges you face being an editor-in-chief.
Multiple. First of all, we have financial problems.
Right.
We are back borrowing and stealing, trying to keep the journal alive.
Right.
We have most of our reviewers who work voluntarily for us, and therefore we cannot sort of push them to work on time. So we have these time delays.
Yeah.
And then, of course, like you said earlier, majority of the people would not adhere to the guidelines that we have provided them.
Okay.
A lot of studies would not be to the mark that we would be wanting to publish.
Right.
And then, in all honesty, we sometimes, if we feel that there is enough material in that manuscript, we actually practically rewrite that article for that author ourselves.
Oh.
We guide them up, we tell them, okay, do this. So there are multiple times that it goes back and forth for that. So can't be very strict. At the same time, to keep the journal going, I need those articles as well.
Yeah.
And I keep on asking friends, I keep on asking my students, I keep on asking people that please, send a submission to us. So, A, there is dearth of standardized, let's put it this way, standardized manuscripts. B, there is dearth of reviewers. And C, of course, there is a major dearth or a deficiency in article writing skills. That has to be something that has to be looked into. Excuse me.
Please also do tell us what was the motive behind starting IADSR, the International Association of Dental Sciences and Research, for which you are the founding president.
You see, what happened, I tell you one story. When I was doing my final year, all of us were trying to apply for postgraduate programs.
Right.
And we would go to our teachers to write the recommendation letters. And majority of the teachers would tell us, okay, you go and write it yourself and I'll correct it and I'll sign it for you. So I wrote this article regarding research and my intuition towards that. And I asked one of my class fellows to please see if all is well and correct it. And what she did was that she wrote another sentence at the end. And it was the interest in research, and it said that, and me being the specimen. So I was crazy from the word start. The reason we started IDSR was that when each one of us, all of us in fact, when we graduate, starting from where I graduated in 1980 and today, there are certain skills that are taught to us in dental school.
Yes.
And then there are certain skills that are expected of us when we start up a clinic. So there's a gap there.
Yes.
And by the way, we did a small research with Dental News being one of the partners with us in Pakistan in 2015 in self-perceived competencies. And those gaps have been accepted by the fresh graduates as well. So basically the reason was that we wanted a practice-ready dentist.
Yeah.
And we were trying to cover those gaps. Secondly, when we graduate, we feel that I know it all, what the hell, I'll manage this, I'll do this. But the concept of continuing professional development, and that's why we launched it with a very huge conference. I think it was the largest in the history of the country. We had about 4,000 odd registered participants in that. And we had 3 components in that. And it had education, research, and healthcare. So all 3 fields, we felt that this is where there are gaps that need to be filled. And there is a serious lack of training for the fresh graduates to come in. The whole idea was that we would guide them to, go to certain directions, give them some guidance in their career. Because when I was growing up professionally, we were like a dog and cow. So I would hit this wall and I'll go in this direction. But in my time, there were actually a larger amount of opportunities.
Right.
I didn't even have to be good to be where I am today. I just had to be a slightly better.
Right.
And when it comes to your generation, you have to be the best.
Yeah.
Because the competition has gone
It's
up.
tough,
You
yeah.
know, 40 years ago, my registration number is 899. Right, so now I look at 40,000 and I say, God, I am ancient. But that's how it was, because I was the 899th dentist in this country, and that was 1980.
Yes.
So it's not century ago, but it's almost half a century or maybe 40 years ago. So that's where you are too many of you now, and you actually need to excel.
Yeah.
And for that you have to plug in the gaps that exist, that are there. And we all know it.
Yeah.
You know, the best part of the life is that if you start looking at where your gaps are, right? And I would not like you to be in a position that I was. I remember writing my second article, and it was on TMJ dysfunction, and we looked at it and we found that it is more prevalent in professionals than in non-professionals.
Okay.
So I write to this community dental health and send it over. And this guy writes to me and he says that how was the reliability of this study checked?
Okay.
Now, like the illiterate that I was, and at that time living in Zimbabwe where apartheid was the name of the game, so I actually did that, you know. And today when I repeat it, I feel like the earth should actually part open and I should go in and sink myself in there. But I wrote to him and I said that just because my name is Khan Khan, you feel that my data is not reliable. And if my name was Kahn Khan, because that's a German Khan.
Oh.
So there is a German Khan as well, which is Kahn. My data would have been reliable. And I take my hats off to that editor, because what he did in response, instead of getting angry, I actually got that paper published in the same journal.
Really?
He sent me an article, actually a chapter on reliability of a study. And God, I was so ashamed of myself that day. And I didn't want my kids to feel, you know, lost in this field.
Right.
So I started most of the things at the spur of a moment, as an angry young man, or as a reaction to something. But there are things that you need to know to learn. So, and that is the reason we started IDSR. It was basically to fill in those gaps for the fresh graduates to come into practical life, whether it's research, whether it's education, whether it's healthcare. So that's how.
So I have a personal question at this point. I have noticed that in the Bachelor's of Dental Surgery program taught here, there is this component of epidemiology and biostats that is not taught in undergraduate programs, but graduates of dental studies are required to enroll into a master's program just for this. Do you believe that this aspect should also be part of undergraduate studies?
It is. You know, I almost started an article and have stopped it, and that was basically the practicing scientist.
Right.
Every professional, healthcare professional, has to be an investigator.
Yeah.
Because unless and until they are an investigator, they cannot improve themselves. And for that, you don't need high-end this thing, but you need the basic knowledge of epidemiology.
Yes.
You need to know what mean mode this is, basic statistics, and you need to just look around and see. So I am a total proponent. Yes, it should be done, and I actually recommended it to some of my younger colleagues the other day who were revamping the community dentistry course, because I have the dream of having this course taught in all 4 years and examined in the final year.
Yeah.
So we need to give them bits and pieces that actually go up and that scale up their perception. I think it's not very wise to tell them about caries when they haven't learned, haven't studied oral pathology and pathology.
Yeah.
So that they need to know these things before they go further. So
Definitely.
that's why there need to be a modular change in this.
Right. Dr. Yas, what would be your advice, dental related or otherwise, for nursing mothers and for pregnant women that are unable to or forget or don't think that it is important to let the dentist know during the first few months of conceiving that they have a history of being pregnant or having conceived or nursed?
Multiple options, multiple advices, I would say. Uh, if you have a dental problem, get it sorted out ASAP.
Right.
And when you go to the dentist, please tell them that you are pregnant. So that they have their own way of handling things then that way. And we actually won a project of 30,000 euros, and the logo was brush day and night for a healthy mother and child.
Okay, wow.
Right? And we did that in Lahore, Karachi, Islamabad. We did that in 2010, 11, 12. FDI sponsored that. And we found that mothers are, and especially expectant mothers and mothers of the younger kids, are actually very perceptive towards behavioral changes at the time of their pregnancy and when they're bringing their kid up. Because the whole life is focused there. Right. So you need to encash upon that. And we saw women brushing who have never done it before, brushing every day, twice a day. And of course, initially we gave them samples to brush, and then we monitored them, and they actually continued to do that.
Okay. Regularly.
Till the time they were pregnant.
Oh.
So because we did tell them that the chances of having a preterm and low birth weight babies is higher if you have gum diseases.
Right.
So they put the fear of God in them. And then in the kids, we did advise them. I actually do not propagate that, but sometimes you have to do it. That the failure to thrive, if you have an oral infection or a persistently oral infection in your mouth, is there. It is research based. And that actually put the fear of God in their mouth, in their minds, and they kept on doing that, at least for a year that we kept on monitoring them. So that was the end of the project, and we forgot all about that afterwards.
And what about nursing mothers? How do we get them to?
Well, nursing mother is the same because the bacterial load in an expectant, in a mother of newborn, actually the bacterial load in the oral cavity deposit the bacterial load in the blood circulation, and which in turn is transferred to them through the mother's milk, because that actually is a replica for that.
Yeah, then there's also gestational diabetes, gestational periodontitis.
We have got somebody working on it right now.
Okay.
We have got a fresh PhD coming up, inshallah. And then that we are looking at periodontal disease as a marker to gestational diabetes.
Diabetes, okay.
So we are looking into that.
Okay.
There have been some studies, but not comprehensive enough.
And what about your dental advice for those who are cardiac patients or hypertensive patients?
Simple. We did a study, and it's published and claimed that study has an impact factor of 14.
Okay.
Right? So, and it very simply says that if you are a high-risk cardiac patient, you do simple scaling, brush day and night, your chances of becoming a medium risk is 22%.
Right, okay.
If you're a medium risk and you do the same, you are 22%. So actually 1/5 of your risk is reduced by just improving your oral hygiene.
Okay.
And that we have done a large study, and it's globally acclaimed. So people are actually giving our reference to that. And I think that is something which is there for the cardiac patient to look at.
And how regularly do you advise patients, cardiac or otherwise, nursing mothers also, pregnant women also, to get their scaling done?
That's controversial.
Oh, okay.
Honestly, because there are school of thoughts which say that plaque will reappear within 5 to 7 days if they don't maintain it.
Right.
And there are school of thoughts which say that if you polish the existing calculus enough, you would stop further this thing. and of course there would be no gap. The patient would not feel that gap, and it's easier for them to maintain them. So that's very controversial of how frequently it has to be done. There are, however, studies that have said that, okay, if you do your brush well, even once a day, that's good enough.
Right. And Dr. Ayyaz, my final question is, what advice would you like to give to those that are planning their career and their profession in clinical research?
Look, it's D to D.
Okay.
That's what my grandfather used to tell me. D to D is deserve to desire.
Right.
Right. So, clinical research is not something that you can walk into. Clinical research requires a lot of hard work. It has a lot of regulations that cover it, and we need to cover all that. You know, for example, we lost a clinical research contract of 100,000 euros just because of the simple fact that we couldn't get an insurance on ground for our subjects. Because there was no insurance company that was doing it for us. So that there are, the clinical research is a fairly tight things to know, and you need to know what you are doing, get yourself into, because I would strongly recommend not to do a clinical research if it is not registered with the Register of Clinical Research, which is held in United States. It's online, it's free of cost, but you have to register every clinical research there. And that clinical research is then authenticated by your methodology. Then you submit your methodology, it's peer reviewed, and they check it out whether you're doing it right or not. And then of course there are steps that you need to see if you've been following those. So clinical research is, I would say, 2 steps away. If you want to start research, start from simple descriptive studies. But please don't come and tell me that there's a DMFT score of this much. You need to give me something different from that, more than that, right? Correlated, I keep on telling them, giving them ideas, correlated with the consumption of soft drinks, carbonated drinks, correlated with consumption of confectionery. So do something different. As I said, it doesn't improve it. So start with descriptive, and then you need to do at least 1 or 2 systemic reviews. If you do a systemic review, you would know what to look for in a randomized controlled trial, because that is the end result of a clinical trial. If you are doing a clinical trial, you are doing a randomized controlled trial, and that is the crown on top of it. So that's how you need to do.
Thank you so much, Dr. Ayyaz. We had a wonderful conversation. I hope it was very informational and educative to everybody who was watching. Please do subscribe to the Health Talk and Dental News' YouTube channel to watch more of such informative videos regarding medicine and dentistry. Thank you so much.